I'm Fiona, the oncology dietitian working in South Tyneside and Sunderland NHS Foundation Trust. Following a cancer diagnosis, we understand you may go through a period of uncertainty and anxiety, which can lead to a loss of appetite and weight. Eating a varied diet or being nutritionally optimized is one part of getting you ready for rehabilitations in preparing for your treatment. The other parts are being physically active and looking after your mental well-being. Focusing on these areas can help you feel more control in your health, coping better during treatment, and recover better after your treatment. It is common for cancer patients to struggle with their weight. For example, you may find that you can lose weight rapidly due to the increase of energy requirements. While it is also important to note that being underweight at the time of diagnosis can affect how well you cope with and recover from your treatment. If you are within healthy weight, you should continue following this advice. Eating a varied diet together with being physically active. Try to continue with a varied diet following the Eat Well plate and drinking plenty of fluids, for example 6 to 8 glasses of water to keep yourself hydrated. Fruit and vegetables are full of vitamins and minerals as well as fiber to help with our digestion. Aim to have at least 5 portions a day. A portion is about 2 to 3 spoonfuls of vegetables, 1 medium pieces of fruit, 2 smaller fruits such as plums and clementines, and a handful of berries. Starchy carbohydrates are responsible for giving us energy. Aim to have a portion of starchy carbohydrates at each meal, such as potatoes, bread, rice, and pasta, and choose whole grain versions if possible to have a little bit more fiber in it. Protein is very important for maintaining your muscle mass throughout your treatment and wound healing after the surgery. Aim to have roughly 30 grams of protein per meal 3 times a day. Beans, pulses, tofu, fish, meat, and eggs are all good sources of protein. 30 grams of portions roughly means about 3.5 ounces of cooked chicken breast, 4 ounces of cooked salmon, 1 cup of Greek yogurt, and 5 large whole eggs. Dairy products help to maintain healthy bones throughout your treatments, and they are a good source of protein too. Examples including milk, yogurt, cheese, or their non-dairy alternatives that have added calcium. There are small steps you can do while waiting or during your treatment. Keep an eye on your weight and report any dramatic changes to a health professional, your GP, and your dietitian. Keeping a food diary with portion sizes will give us more information, which means we will be able to help you better. There is inaccurate dietary information on the social media, so only follow information from reliable sources. Educate your friends and family. It is important that your loved ones understand the importance of nutrition before and after your cancer treatment, especially if they normally cook for you. As a result of cancer, some people can have a reduced appetite even before their treatment started, while they may also find that their taste changes, have difficulties in swallowing, problems with digestion, muscle wasting, and dehydration due to the treatment. Having diet problems when you have cancer can affect you emotionally. Meal times can be challenging and distressing for you and the people looking after you. It might be helpful to discuss any changes in your eating habits with them to help them understand how you feel at the time and support you better. A dietitian may also be able to offer you support and help you with your dietary problems. If you are underweight or struggling with your diet, consider having small but frequent meals and choose full-fat versions if possible. Understandably, you might be going through a lot and overwhelmed with the information. Everyone will have different needs, so do what you can and be kind to yourself. Do not hesitate to speak to your key worker and dietitian for additional individualized support.